The next case study is regarding cancer. So here what you will write for case study is pain in the stomach. So you can just, this is the only condition that was given to the doctor, pain in the stomach. So basically what the doctor would do, there would be a small test run, but what exactly has happened will be studied through the scan. Okay, so when a scan has been done, it was observed. So the patient brought a scan report which has a lump in the stomach, and the patient is reporting only the pain, nothing is there. So basically what exactly is the problem? As a doctor, you're going to write few things. Number one, what it is, and then what are the types, and then what are the causes to it, plus the treatment. So all these headings, only one line answer, only one line. Okay, so what is it? It is abnormal, uncontrolled, purposeless division of cell, and that's on page 234. We're talking about cancer. Okay, so it is abnormal, uncontrolled, purposeless division of cell. Then what are the two types? It is benign and malignant. Benign means something that grows slowly. Benign, here we have, okay, benign and malignant, something that grows slowly and stays in one place. It doesn't move. Malignant is where it grows rapidly and it can spread. So that's why we say it is malignant. It's dangerous. Then what are the types? We have the types. Next page if you go, you have carcinoma. अगर epithelial tissue में है तो उसको carcinoma बोलते हैं. Sarcoma तब बोलते हैं when it is in the connective tissue. So just one line. Lymphoma means lymphatic tissue like spleen. Leukemia मतलब we are talking about the excessive increase in WBC. We have already done this. Then adenocarcinoma is something to do with thyroid, pituitary gland में when it is there. Then what are the causes? It can be chemicals, any chemical. It can be any chemical we use for day-to-day life, any kind of chemical. Then radiation, if a person is subjected to any kind of radiation, work related. Then virus, we have virus inside our body also, they can get activated even. And you go to the next page. Then oncogene is something we are talking about, is a gene that has got the ability to get activated and cause cancer. So that can be activated by any kind of activity. So oncogene. And then addiction. Some people are addicted to tobacco. So these are the cause. How can you treat it? So basic treatment is very simple. If certain chemicals are used, you call it as chemotherapy. Okay, treatment में क्या है? If chemical is used or drug is used to stop the division of DNA, so it's called chemotherapy. अगर radiation use किया तो radiotherapy बोलते हैं. और अगर स्पेशली जैसे कि अगर यूट्रस में है तो यूट्रस रिमूव करते हैं तो दैट्स कॉल्ड सर्जरी. अ पर्टिकुलर पार्ट विच इज़ अफेक्टेड उसको रिमूव करते हैं तो दैट्स सर्जरी. इम्यूनोथेरापी मतलब इम्यून को बढ़ाने के लिए व्हेन वी पुट इन, वी इंड्यूस अल्फा इंटरफेरॉन्स. ओके, दैट्स ऑल्सो मेंशन्ड हियर. Sorry. And the supportive therapy. Supportive means psychological support given to the patient. So only one line of each you have to write for cancer, right? And if a question comes, when tumor grows, you don't use the word grows or it spreads. We use the word metastasize. You just go to this page, that's page 234. This is an important word, okay? Metastasis. So that's the growth, increase. And the one who studies about the cancer, that physician is called as oncologist. इतना सिर्फ कैंसर के लिए. नेक्स्ट केस स्टडी विल बी फॉर एड्स. So here in AIDS, you can write a case study where a small child was brought to the clinic with high fever for last 5 months. That's something weird, right? 5 महीने से fever मतलब there's something different. So the test was run and this first doctor suggested ELISA test. Now the question is, why did ELISA test come into the confirmation, or why did the doctor suggest ELISA test? That's your question. So what you will be writing, the disease is AIDS, the full form. So you better go to that page. Just short, one line each. What is AIDS? Acquired immunodeficiency syndrome, full form. Okay, so basically caused by which specific reason? It's because of the retrovirus. Virus जो कि RNA का बना है. Okay, सिंगल स्ट्रैंड SSRNA मतलब सिंगल स्ट्रैंड RNA, जिसको हम बोलते हैं ह्यूमन इम्यूनोडेफिशिएंसी वायरस, जो कि इंसान की इम्यून सिस्टम को वीक कर देता है. एंड देन just no need to draw the diagram of the virus. Now what are the ways by which that child must have got? The probability is only the third option. Virus ka transmission ke only 3 options are given, but the third option would have been the reason. But what are the ways, or it can be transmitted? Number 1 is unsafe sexual contact, then the blood through blood transfusion, or from mother to child. So this was a small child that was brought to the clinic, so it is from the mother to child. And there is a study that's been done for this last paragraph. इसमें specific reason question आ सकता है. Urine, tears, saliva, breast milk, and even vaginal secretion, they have virus. That's HIV virus, but they don't transmit through it. Okay, now how, or basically you can say, once you get this disease, I'm talking about HIV enters into body, right? So जैसे ही enter होता है, the person will not be considered as an AIDS patient. It is just the initial stage. Okay, so there are different stages in AIDS. Number 1, you have to remember 4 stages in a patient who is suffering from AIDS. What are the stages? Number 1, initial infection, matlab virus has entered. Okay, and that's around initial infection stage. Second is जब कोई symptom ही नहीं है, asymptomatic, right? When there's no symptom only, it's asymptomatic. That's around after the entry, मतलब 6 महीने और 10 साल के बीच में. It can be like that. And then the third one, when different complexities are seen, fever, tiredness, continuous diarrhea, सांस फूल रही है, loss of more than body weight, बहुत पतला हो गया बच्चा. So it's like so many symptoms can be observed. And the fourth important is the stage when you actually say it's AIDS, because HIV infection has become life threatening. मतलब इस time the patient can have different disease, 2-3 disease together, even in severe forms, because immunity has gone. The person is not having any kind of immunity. So कई बारी pneumonia भी होता है, कई बारी साथ में there are some other problems also, which is, so it's always syndrome. See the words acquired immunodeficiency syndrome, right? So it's not one problem. Syndrome means many.